Hello, everyone. Can I ask you a question? Have you ever had a bad hair day? What about a no hair day? Well, let me tell you about a time when I was 29 years old and a mother of 4 small children. I received news, 3 small words that no one ever really wants to hear, and that is, you have cancer. Yep, this is me with my brother. You probably don't recognize me because I have hair now. But in that moment, my world went into a tailspin. I was thrust into tons of appointments, decisions, and treatments. But the truth is, at that time, I felt like my voice was very small, like it really went unheard. Doctors had all of their protocols. Nurses had their checklists, and friends and family tried to be encouraging. Now, I wouldn't choose some of those options knowing what I know now, but I am at least here to share my journey with you. The decisions I made then, not knowing what I didn't know, have left me with some residual effects, and that is why I do need to use these notes. I often look back and think what I really needed is somebody just to sit down and listen to what I needed to say, or just hear what I didn't even know, what I didn't know. But at that moment, it planted a seed. And I saw things that were going unchecked or something I needed at the time. And that was advocacy. In cancer, it shows that there is a reduction in cancer mortality by at least 2 years when you have a patient advocate. And there is a reduction in healthcare costs by 20% when patients have an advocate that can ask questions and help formulate the questions and the answers and just the support. Let's look at how our healthcare system fails you. We are no longer a healthcare model, but we need to go from the sick care model to a whole care model. We have state-of-the-art equipment, advanced technology, and all of these medications. But patients often leave confused, frustrated, even misdiagnosed, or they even leave untreated. Families feel divided by the stress that this is causing, and providers are feeling burnt out by all of the time constraints and the checklists and quotas that they're supposed to be meeting. We don't really have a healthcare model anymore. It's reactive, it's transactional, and quite often impersonal. What is missing at the center? It's listening. If you get nothing else out of today, learn how to listen. Listen for what's beneath, something even as what is being unsaid, something that you can hear that isn't being spoken. One should be quick to listen, slow to speak, and even slower to anger. 1 in 20 US adults experiences medical errors in the US. That's millions of voices that haven't been heard. It's crazy to think that we're rushed through appointments just because we're not heard or listened to. Years after my own cancer journey, my dad, Ted, ironic that I'm paying tribute to my dad, whose name is Ted, on the TEDx stage. But years after my cancer diagnosis, my father, Ted, became ill. It was very apparent to all of my family and I, but all of the tests came back normal. So he was going to be sent on his way. But because of my patient advocacy, I pushed for one more test. The doctors, because I had built a rapport with them, they trusted me. They trusted my gut instinct. And they ran the test, even though it was not fitting into their protocol, they ran it anyway. They listened. That test gave us 12 extra years. 12 years of Christmases, 12 years of birthdays, 12 years of everyday miracles. Because someone chose to listen. You have to hear what is being unspoken. That test changed everything. But what happens when you feel like you're not being listened to? What happens when you don't have a voice or no one to advocate for you? You often feel dismissed, frustrated. Families become divided under the pressure. Providers, the diagnoses are delayed or untreated, and hope fades. Diagnostic errors don't just cost money, they cost lives. Think about this. A recent Johns Hopkins study showed or found that diagnostic errors cause 370,000 deaths and leave 400,000 people disabled every year. Not because medicine isn't available, but because the right questions aren't being asked. Listening is not optional, it's essential. In my dad's final chapter, emotions were raw, grief, frustration, confusion, all swirled. But because we had listened to his wishes, before that moment, I could step in and be his clear, calm voice one more time. I could preserve his dignity because we had those tough conversations. I could hold our family together. Listening didn't just extend his life, it preserved our relationships. Here's what I propose. Let's shift from sick care to whole care, a system grounded in listening, prevention, and collaboration. Imagine a world where providers are trained not just to prescribe medications and tests, but to hear stories. Like this week, I was told about pants. You see, it wasn't about the pants. It was about incontinence. But see, the patient didn't want to tell me about the incontinence. They just wanted to tell me they needed more pants. It wasn't anything to do with the pants. Listen to the story. Patients need to feel safe to tell their fears, share their values, their priorities, not just their symptoms. Health teams integrate nutrition, stress, sleep, faith, mind-body connection as core values, not as fringe options. Because when we listen deeply, diagnoses are more, the protocols that come around those diagnoses are more apt to be followed, and the outcomes are exponentially better. Functional health gives us a model for this to be our future. A way to bring this listening mindset into real science-based care. Let me leave you with 3 steps you can take no matter who you are. First, find a healthcare provider and ask questions about their kind of care. Ask up front about their timing, their approach, and if they are whole person focused. Providers train in active listening, not just hearing the words, but sitting in the silence and listen for their context, their body cues. Encourage family advocacy. Invite them in to be a part of the patient's protocols and programs. They see far beyond what the labs ever tell. These aren't extravagant changes. They're intentional choices. Listening gave me 12 more years with my dad. Listening carried me through my cancer journey. And listening preserved my family. So I ask you, what if we became better listeners? As doctors, as patients, and as caregivers. Well, and just as humans. If we did, we wouldn't just improve healthcare, we would revolutionize it. The future of healthcare does not lie in a pill or in a machine. It lies in something much more powerful. Our time on this earth is short, but the legacy of how we listen, how we love, how we care for one another lasts far beyond us. True healthcare is not in another diagnosis. It's about truly hearing the story of the person in front of us. We are reminded that as far as our eyes, to fix our eyes not on what is seen, but what is unseen. For what is seen is temporary, but what is unseen is eternal. May we choose the courage and the compassion to listen, not just for today, but for eternity. Thank you.